Hi guys, welcome in. I'm sorry, I'm just trying to try out this thing. Thank you so much. Auntie Mary, who is here? Let me see. How do I even know who is here with me? Let me see. So I want to briefly talk about chronic kidney disease, yeah? I don't know how to set up this thing. This is my first time, so my camera, everything is just messed up, right? So forgive me, but I think with time, I'm going to figure it out. I want to talk about chronic kidney disease briefly, and then I'll go to bed. Forgive me about the views. I couldn't do a proper setup, so forgive me about the lightning and everything, right? I don't know who is here with me, but you are welcome. My name is Dr. Felix Mawuko, and I want to briefly talk about chronic kidney disease, and hopefully we'll learn about it. So let's start. What is chronic kidney disease? Chronic kidney disease simply means that you have what? Slow progressive loss of kidney function for a minimum of 3 months, okay? Slow progressive of loss of kidney function for 3 months or more. Guys, let me just try and figure my way out here. So let's continue. That is what we mean by chronic kidney disease. When you have a slow progressive loss of kidney function for a minimum of 3 or more months, then we say that you have chronic kidney disease. All right, so take note of that. How common is chronic kidney disease? Chronic kidney disease is actually very common, okay? Globally, we have about 10% of the total global population who are living with chronic kidney disease. And every year, unfortunately, about 1.5 million people lose their life to chronic kidney disease, right? So take note, about 10% of the global population lose their life to chronic kidney disease, and every year about 1.5 million people lose their life to chronic kidney disease, right? So take note of that. Now, what are the causes of chronic kidney disease? What are the things that when you do, it leads to chronic kidney disease? One of the causes, so here, let's do it this way. I'm going to break it down, the causes in terms of medical conditions and also lifestyle conditions, okay? Medical conditions that causes chronic kidney disease, and also lifestyle conditions that, in other words, things that you can be doing that can cause chronic kidney disease. And then we also have what? Things like medical conditions that cause chronic kidney disease. Let's go through the medical conditions that can cause chronic kidney disease. Now, one of the causes of chronic kidney disease globally is what we call diabetes. When you have sustained elevated blood glucose, uncontrolled sustained elevated blood glucose, okay, known as diabetes. This is one of the leading causes of chronic kidney disease, or CKD, globally. The second cause of medical condition that causes chronic kidney disease is what we call what? High blood pressure. Hypertension is also the second causes of chronic kidney disease. How does this happen? When you have high blood pressure, look at your kidney like a sieve, right? Look at the kidney as a sieve. So when the blood that is entering the kidney is going it, okay, it's happening. Let's say I have a sieve and I'm sieving things through this sieve. What is going to happen? If I'm pushing the water under high pressure, okay, through this sieve, at the end of the day, I'm going to destroy the sieve. The same thing happens with hypertension. If the blood pressure that is entering the kidney is very high, it is going to cause kidney damage, kidney injury. At the end of the day, you get fibrosis. Also, the artery that carries blood into the kidney, over time, as the pressure is so high, the renal artery that carries blood and other things into the kidney for filtration, the smooth muscles inside this artery are going to be damaged. When this happens, what is going to happen? The muscles will become very narrow. Blood will now be pushing through your kidney at a very high resistance. When this happens, you can get kidney problem. So second cause of chronic kidney disease is hypertension. The next medical condition that causes chronic kidney disease is what we call glomerular nephritis. Glomerular nephritis. What is glomerular nephritis? Our kidney has structures, okay? One of the structures or the component of the kidney is what we call what? The glomerular apparatus, okay? This together helps you to what? Filter blood and order. If you have any medical condition, that's what? Affect the filtration membrane, causes inflammation of this filtration membrane, the glomerulus, okay, and also the nephrons. We call that what? Glomerular nephritis. Inflammation of this functional unit of the kidney is one of the things that causes what? Chronic kidney disease, and we broadly call that glomerular nephritis. The other medical condition that causes chronic kidney disease is what we call what? Polycystic kidney. Polycystic kidney. What is polycystic kidney? Polycystic kidney means that your kidney, okay, instead of it having the cortex and then the medulla, everything is matted together. And what is happening? You now have a cystic kidney. Your kidney is big and is filled with water, okay? That is known as what? Polycystic kidney, and it's actually genetic, meaning you can inherit this condition. So take note of that. Another medical condition that causes chronic kidney disease is what? Autoimmune condition. When you have autoimmune medical conditions such as one, lupus, okay, systemic lupus erythematosus, all right, this also causes glomerular infiltrations, and at the end of the day, it can destroy your kidney, and over time you get chronic kidney disease. So take note of that. Now let's continue. Another medical condition that causes chronic kidney disease that we have to be aware of is known as what? It's known as sorry, for a man, let's say you're a man, over time you develop what we call what? Prostate enlargement. Your prostate gland becomes enlarged and occludes the flow of urine from your bladder. When you have prostate enlargement or prostate cancer, it can block the flow of urine because the prostate gland is just at the base of what? Your bladder. When that's happening, it will constrict the urethra. Over time, you may not be able to pass out or empty your bladder frequently. Urine can start flowing backwards into your kidney, and that can lead to chronic kidney disease. So take note of that. The other medical condition that can cause chronic kidney disease is what? Kidney infections. If you get a kidney problem that is not promptly diagnosed or promptly treated, what can happen? You can get chronic kidney disease at the end of the day. So recurrent kidney infections, okay, they can destroy the kidney, and over time the function, the makeup, the morphology, the organization, and the architecture of your kidney can be disrupted, and over time you will get what we call chronic kidney disease. So take note of that. Now, most importantly, let's go through medical, non-medical. Now, those are the medical conditions. Let me recap for you again. Number one, diabetes. The leading cause of chronic kidney disease is diabetes. Number two is what we call hypertension. Hypertension or high blood pressure. It will also cause chronic kidney disease. The next one is what? Autoimmune conditions such as lupus, okay? Lupus also will destroy your kidney over time. Then inflammation of the glomerulus and then the nephrons within the kidney, okay? Known as what? Glomerular nephritis. This can also what? Cause what? Chronic kidney disease. Another medical condition that causes chronic kidney disease is when you have polycystic kidney. Polycystic kidney. When one of your kidneys or both of them, okay? Most commonly, it affects only one. You have one big kidney, and this kidney, what happens? This kidney becomes filled with water. Mostly is genetic in origin. It can also cause chronic kidney disease. So take note of that. Forgive me about my camera setup. Today is my first time. I am just trying out this, so forgive me. I think with time I'll figure it out. I just opened it. I've never gone live on YouTube before. So let's continue. Now, what are the medical conditions that causes chronic kidney disease? What are the medical conditions that causes chronic kidney disease? Those are the things I've mentioned, including the BPH, benign prostate hypertrophy, and all that. Now, if you have a heart condition, okay, that can also affect your kidney and lead to chronic kidney disease. So chronic heart conditions can also affect or lead to chronic kidney disease. So take note of that. Now let's move on to look at medical conditions that causes chronic kidney disease, okay? Those are the things I've mentioned. What are the lifestyle things that when you do, okay, All those things I've mentioned are medical causes. Now let's move on to lifestyle. Okay, things that when you do on your own, it can cause chronic kidney disease. Please forgive me about the setup. I've never streamed on YouTube before. I have just decided to try it today, so I just opened the app. I don't even know where the things are. I just went live because I saw the bottom there. I don't know which one to use. There are a lot of things here. I'm seeing grow, I'm seeing what, a lot of things. I don't know which one to use, so I am just trying it for today. With time, I think I'll get the setup right. Let's continue. 4 people in the house, you are welcome. My name is Dr. Felix Maoko, a specialist medical doctor, and this is what I do, and this is what my channel is about. We'll be learning about diabetes, everything about medical condition. This is where you get it from. Connect with me, join me, subscribe to this channel. Let's learn. Let's continue. Lifestyle things that causes chronic kidney disease. In other words, what are the things that you can be doing that can cause chronic kidney disease? Number 1 is dehydration. If you are here and you are always dehydrated, if you like what I'm doing, you can give me a like. Also tell me that you like what I'm doing. Give me some likes. Let me continue. All right, God bless you. Dehydration is one of the important lifestyle conditions that when you do, it destroys your kidney. How does dehydration destroy our kidney? Please stay with me. I'm screaming through the options there because trust me, today is my first time here and I'm just trying this out. All right, so let's continue. I think later I'll figure it out. Medical conditions, I've talked about them. Now we want to look at lifestyle. In other words, things that when you do, it leads to chronic kidney disease. Things that when you do, it leads to chronic kidney disease. One of them is dehydration. If you are somebody who doesn't like drinking water all the time, you are dehydrated, this is going to put your kidney under stress to filter the blood. When the blood that is getting to your kidney is highly concentrated, it makes your kidney to overwork itself. Over time, you will get kidney injury, and that is how you end up with chronic kidney disease. So dehydration is one of the lifestyle causes of chronic kidney disease. So take note of that. Take note of that. Now, another lifestyle condition that you do that destroys your kidney is holding onto urine. Holding onto urine. Holding into urine. If you are somebody all the time when your bladder is full, instead of going to empty your urine, you don't empty the urine. However, you hold onto your urine over a long period. What is going to happen? Once the bladder is filled up, it is going to cause your urine to backflow into your kidney. Remember, your kidney has removed these toxins through the urine. Now, when you hold the urine, your bladder is full. Let's say in the morning, you wake up, you feel like urinating, or in the middle of the night, your bladder is full. Instead of waking up to go and urinate, you cover yourself up, you are hiding under your bed sheet, holding on to the urine. Once the bladder is filled up, what is going to happen? It is going to cause the urine to flow back into your kidney. Over time, what is going to happen? You are going to destroy your kidney because now the toxins, all the toxins that the kidney has filtered is now being sent back to your kidney, and over time you will destroy your kidney. So holding on to urine is also one of the lifestyle conditions that destroy your kidney. Taking a lot of red meat, diet, unhealthy diet is also another lifestyle that destroys our kidney. How does this destroy our kidney? If you are somebody all the time you are eating processed meat, you are eating red meat. This red meat or animal proteins in general, they contain what we call what? The purines. Purines at the end of the day will be broken down to produce uric acid. When you eat a lot of red meat, more purines are introduced into your body, and also what is going to happen? More uric acid is going to be produced. Once more uric acid is produced, it means that what is going to happen? Your kidney has to overwork itself to what? Excrete to remove the excess uric acid that is being produced, and therefore kidney injury can occur because you are taking a lot of red meat. So my advice to you is this: please cut down on red meat. I don't eat red meat at all, so take note of that. Don't worry, I'm just trying the things on the screen. I don't know how this thing work here. I'm just trying it for the first time. So let's keep going on. Let's keep going on. So we've talked about dehydration as a lifestyle condition that destroys your kidney. We've talked about what? Holding on to urine, or in other words, when you feel like going to urinate, but you don't do that, that can also lead to kidney destruction. Now we are talking about unhealthy diet. Anytime you are taking a lot of animal protein, processed meat, all of them, they will destroy your kidney at the end of the day, and you end up with chronic kidney disease. So take note of that. Another lifestyle condition is eating a lot of salt. Okay, too much salt is not good for your kidney. Our kidney has what it calls, or we have what we call sodium potassium pump. Okay, this sodium potassium pump tries to balance the amount of sodium and potassium. Once you are eating a lot of sodium, what is going to happen? Sodium means that salt. Okay, now anywhere sodium accumulates is going to draw water onto itself, meaning that over time, because you are eating a lot of salt, what is going to happen? You are going to accumulate a lot of water. Once you accumulate a lot of water, what is going to happen? You are going to cause fluid overload. Our kidney is what balances the amount of fluid that we have in our body, and therefore the more salt you have, the more salt you eat, it means that I got said something I was looking at. It means that because you are taking salt, more water is going to accumulate, and now you have to overwork your kidney to what? Excrete or balance the water. Over time, your kidney is going to get destroyed. So too much salt or excess sodium from either caffeinated product or other things, or sweetened product, all of them, this canned product, canned vegetables, canned meat, processed meat, all of them contain a lot of sodium. So take note of that. If today is my first time here, I've never tried streaming on YouTube yet, and therefore I am trying to do it today. So please bear with me. My camera setup, I don't even know my way here, but I am just trying it to see how it goes here. So forgive me. Over time, I'll get a setup, and then we will continue, and I'll give you a better screen. Okay, so let's continue. But my name is Dr. Felix Mawuku, a specialist medical doctor in Ghana. Okay, and this is what my channel will be about. Stay with me. Very soon we'll get a good background, a good setup, and everything will be rolling. Let's continue. Right, so red meat intake, a lot of salt and all that will cause chronic kidney disease. So stay with me. Lack of sleep. If you are somebody who does not sleep adequately, you don't sleep adequately, what is going to happen? Because your kidney, there is an aspect of your kidney function that comes into play when you are sleeping. The more you sleep, the more it functions well. Now, if you are somebody who is not sleeping well, what does it mean? It means that aspect of your kidney where it functions well, and then when you are sleeping, it's going to be cut down. Over time, you are going to end up with chronic kidney disease. We have 4 amazing viewers. Today is my first live stream on YouTube. I've never tried it. I don't know the setup, so forgive me about the screen, okay? I will set it up at the right time, in the right way. Let's continue. So that is it. If you are somebody who is sacrificing your sleep for money, sacrificing your sleep for whatever reason, you are going to end up with chronic kidney disease. My name is Dr. Felix Mawuku, and this platform is dedicated, and this is what it will be known for. We'll be talking about everything medically: diabetes, chronic kidney disease, hypertension, heart diseases, and everything. Most of you know me on other platforms, but now we want to bring the good news here also. So subscribe to me if you have not done that. God richly bless you. Let's continue. Another cause of chronic kidney disease, guys, is stress. Anytime you are stressed, what is going to happen? Stress hormones are released in high quantities. Cortisol, adrenaline, and other stress hormones. Once you have increased stress hormones in your bloodstream, they are also going to make your kidneys, the arteries, the vessels very narrow. Over time, it's going to affect your overall kidney function. If you like what I'm doing, don't forget to give me a like, okay? Click on the like. give me a like. Let me know that you like this information that I am giving to you. Remember, I am a specialist, and today is the first time I have decided to try this app. I've never come live here before. So let's continue. Now, so that is that. Stress on its own will lead to increased stress hormones, and these stress hormones will eventually also cause what? Chronic kidney disease. So take note of that. All right. Let us continue. Another thing that you do that destroys your kidney by way of lifestyle is alcohol consumption. Alcohol consumption. If you are here, you've been abusing alcohol. Currently literature shows that no form of alcohol is healthy for you. So those of us who like to hide behind alcohol and be drinking and say that, oh, small amounts of alcohol is good for your heart. No. Currently, there is no good alcohol. There is nothing like safe alcohol. Even the red wine, once it contains alcohol, is no longer considered healthy for you. So as you take alcohol, what is going to happen? You are going to end up with chronic kidney disease. So take note of that. Smoking is also another one. If you are somebody who have been smoking, okay, this has also been implicated in causing kidney injury, because the nicotine is going to destroy the blood vessels that are supposed to be feeding or carrying blood to your kidney. Over time, you are going to destroy the smooth muscles and everything, and over time, you will end up with chronic kidney disease. So smoking is also one of them. Another important lifestyle cause of chronic kidney disease that I need you to be aware of, guys, is what we call sodas. Okay, you are here, you are always drinking soda, you are always abusing soda, Fanta, Coke, and all those sweetened drinks. The more you drink them, what is going to happen? You are going to destroy your kidney, because sodas have been found by research. Many researchers have come out to show that soda, Coke, Fanta, all those sweetened drinks, they are not good for you, because they are going to what? Increase insulin resistance. When they increase your insulin resistance, you are going to end up with diabetes. Diabetes will destroy your kidney, and that is how sodas end up causing chronic kidney disease. So please make sure that you desist from taking this diabetes and you desist from taking this soda drinks, the Coke, all those things known as sodas. They will end up destroying your kidney. Please give me a like if you love what I am doing. This is my first time here. I just decided to try it here because I've never been here before. I said, let me try it today and see how it is to go live on YouTube. Don't worry, with time I'll get the setup right, and then we will learn. Remember, I am a specialist medical doctor, and I entreat you to keep coming here. I will try in a day to come here, at least even if 30 minutes, and we'll learn about myriad of medical conditions from this platform. So subscribe, turn on notification, and trust me, over time I'll get the setup right, and we shall keep it rolling. 5 amazing people, you are welcome. Please give me a like if you like what I am discussing here. We are talking about chronic kidney disease. We are just going through the types of chronic kidney disease, and I've talked about the medical conditions. Let me recap the medical conditions. Diabetes, number 1, it causes chronic kidney disease. Number 2, high blood pressure. Okay, autoimmune conditions such as lupus erythematosus. Okay, it will also cause chronic kidney disease. And then of course, inflammation of the kidney from glomerulonephritis, it will also cause chronic kidney disease. Then we cause another medical condition that will cause chronic kidney disease is when you have what we call polycystic kidneys, where you have one of your kidney becoming very big and then it's filled with water, with multiple fluid. Okay, multiple water containing fluid in your kidney. Okay, polycystic kidney will also lead to what? Eventually chronic kidney disease. Then we talk about what? Another one such as heart failure. Okay, heart failure can also affect your kidney and eventually lead to kidney problem, because there is an interplay between our heart and our kidney. So that is that. Then we talk about prostate problems in men. A man who gets an enlarged prostate, okay, and eventually it blocks the urethra, okay, the bladder neck, and does not allow the urine to flow. This can also affect your kidney function, and over time you end up with kidney disease or chronic kidney disease. So take note of that. Kidney infections, okay, poorly treated kidney infections such as pyelonephritis, they will also destroy your kidney over time, and you get what we call chronic kidney disease. Now let's move on to the lifestyle causes. I told you that one of the things that destroys your kidney over time and you get chronic kidney disease is you not drinking a lot of water. Okay, so drink a lot of water to make your blood lighter. If the blood gets into your kidney, is very concentrated. It means that our kidney has to overwork itself to sieve the blood. In the process of overworking to sieve the concentrated blood, what is going to happen? You are going to injure the kidney over time. You end up with what? Chronic kidney disease. So dehydration, okay, is one of the causes of kidney disease and chronic kidney disease. So take note of that. Holding on to urine is also another bad lifestyle that I know you have been doing, and I don't want you to keep doing this. How does this happen? So you are in the office, or in the morning, you wake up in the day and you feel like emptying your bladder, but you are like, oh, let me just finish this work quickly and I'll go to the washroom. As you are holding on to the bladder, guys, the urine is going to flow back into your kidney. Once the urine flows into your kidney, what is going to happen? It means that you are not carrying back all the waste product, the toxic materials back into your kidney, and you end up with chronic kidney disease. So please stop holding on to urine. Anytime you feel like going to urinate, quickly go and empty it to avoid reflux of urine. Another lifestyle is what? Stress. If all the time you are stressed up and you're not able to control your stress level, what is going to happen? It's going to lead to chronic kidney disease, because the stress hormones are going to be produced in high quantities. Once that happens, it means that you are going to have problem with kidney function and you get chronic kidney disease at the end of the day. Another one is lack of sleep. If you are not sleeping well, you can also end up with chronic kidney disease. Because why? When you sleep, there is part of your kidney that functions best whilst you are asleep. It means that if you are not giving yourself enough sleep, that aspect of the kidney function that works based on how good you sleep, it's not going to happen. Over time, whilst you are depriving your body of sleep, you end up with chronic kidney disease. So take note of that. All right. Next thing that I talk about is what? Unhealthy diet. So you are here, you are eating red meat, sausages, processed meat, canned product. All of them, they have something in common. Sorry. They have what we call what? Red meat in general, okay? All red meat, especially animal proteins, they contain purines. Purines will lead to production of uric acid. Once you have a lot of uric acid, it means that your kidney has to struggle to what? Overwork and also eliminate the what the uric acid that has been produced in excess. Over time, you are going to injure your kidney. Also, this processed product, this processed meat and all that, they contain high amount of salt. Okay, the more you take salt, more water is going to accumulate. Over time, your kidney has to stress itself to balance the amount of water in your body. You destroy your kidney over time, you cause kidney injury, you'll be on your way to chronic kidney disease, which we don't want you to have. So take note of that. Then we talk about the sodas, Fanta, okay, Coke, all of them. The more you do that, you are going to have problem with kidney problem, because sorry, because all this thing will lead to insulin resistance. You get diabetes over it, and then sorry, this diabetes is going to destroy your kidney, okay, over time. So that is that. So run away from that also. So guys, on this note, this is the end of today's discussion. I just want to be here for 30 minutes. Tomorrow, God willing, I'll come back and we'll discuss the signs and symptoms of chronic kidney disease, okay, in detail. Okay, so please, God bless you. My name is Dr. Felix Mauko. Today is just a test transmission. I don't even know how to do the setup, but I just say, let me try it and see. One of my friends say I should try coming live and see. So I decided to try it. And that is why the screen is very bad. The camera is bad because I'm seeing a lot of things in the bottom there. I don't know which one to use because I've never tried it. But with time, I'm going to learn and then come give you a better screen. So God bless you. I'll be here tomorrow again. Around this same time, God willing. Remember, this platform will be dedicated to medical conditions, okay? This channel is about medical condition, diabetes, chronic hypertension, okay, everything about medical condition. Those of you who know me on the other platform, you know what I do. My name is Dr. Felix Mauko. On this note, God richly bless you. I'm so grateful. Thank you so much. I'll catch you at another time. Please give me a like if you like what I've just discussed today. Click on the like button and give me a thumb up so that we continue doing this from time to time. Bye, everybody. God bless you. Thank you so much. Thank you so much. Thank you.